Healthcare for All and health law advocates are a great voice for consumers. We hear about the problems that people are encountering. We hear about what needs to be fixed, and we are happy to work in partnership.
So this is Carlos Solis. Carlos, Secretary Sebelius.
Hi, nice to meet you.
Very nice to meet you.
We know that we can make an immediate difference in people's lives the minute they call our helpline and ask for help.
Solo son ustedes tres nada más.
Once consumers make a connection with our helpline counselors, they feel like they have a friend and a real ally.
I look to help as many people as I can. What are the problems and getting them fixed? And I'm doing that at the front line.
We hear from young people who have graduated from college and have never had to buy health insurance before. We hear from an awful lot of people who have some kind of life transitions. We hear from individuals who have very difficult circumstances, who have been diagnosed with some kind of illness and in fact their insurance doesn't cover it. Nina is exactly the kind of person who was at her wit's end.
My daughter has what's called speech praxia, and we were told that in order for her actually to be able to learn how to speak, she would need therapy 3 to 5 days a week. Health insurance wasn't going to cover her therapy. And I was in a place that, as a mother, I didn't want to be, because if I stopped her therapy, she might not talk. I mean, because as a child gets older, she would lose that opportunity. Like, this was her window of opportunity to learn how to speak. And she needed this, so we appealed it. It was denied. I called Healthcare for All. So kind to me. And they took all my information and they had filled out, they basically filled out the application.
And we were able to step in and help connect her and make sure that her daughter had the services that has made a life-changing difference to her daughter and to her family.
She has gone from 4 words in June to 6-word sentences right now. That's like in a couple of months. So thank God.
The individuals who are helped is what this is really all about. We have clearly a talking little girl in the front row, which is the perfect example of important help.
Can you give me another 5? All right. I like a girl who can give 10. All right. Thank you.
And the kind of consumer outreach that you have is not only great for the Commonwealth of Massachusetts, but it's great for the country. Those are what's at risk when Congress talks about repealing the law. And on behalf of the President, I can assure you that there is no intention of going back.
Today was a remarkable opportunity to have the Secretary of Health and Human Services, Kathleen Sebelius, join us to be able to talk about our helpline and as a role model for the rest of the country.
Thanks for what you're doing.
I have no doubt that she will go and incorporate the work that she saw here in her continuing advocacy to make improvements to our healthcare delivery system. Healthcare for All in Massachusetts have proven to the rest of the country that you truly can provide healthcare coverage for almost everyone in your state. And we're now poised to take the next step, which is truly to address the cost and quality of the care that we all receive.